So I'd like to start today by welcoming Janet Broughton, to us to deliver today Emotional Freedom Technique or Tapping webinar. Janet is a positive change coach and she specializes in yoga, meditation, neuro-linguistic programming, a whole host of things. She's a sort of more of a holistic coach, but today we'll be talking about tapping for pain management and anxiety. So we also have with us today the lovely Victoria. And Victoria is one of our volunteers who runs one of our 18 to 25 age group Zooms, so support group meetings, and Victoria's very kindly offered today to be Janet's guinea pig to practice with and on. This session is being recorded. You are not being recorded within the webinar. The only people being recorded are myself, Janet, and Victoria. And this webinar will be available probably in about a week's time on the website for our members to have a look at. If you do get kicked out while you're watching, please do just click and join back in again and come back in. So that being said, I'm going to hand over to Janet and ask you to lead the session. Thank you, Janet.
Thank you very much.
Thanks, Nikki.
Okay, thank you very much, Nikki, for inviting me and to be able to spread the word for emotional freedom technique, or as you've generally known quite often as tapping. So I just want to give you some slides so that you can follow along as I explain. So if you just bear with me while I share for you. And there we are. All right, and I can, oops, I've lost something. Okay, we'll do it that way. First of all, myself, I am an accredited master trainer with Emotional Freedom Technique International, which is the professional body for EFT in the UK. And we are linked to the professional body in America as well, which is where EFT started. EFT, it does as it says on the tin. It emotionally frees you, and it is a technique to do that. I first came to it about 17 or 18 years ago now, when I had a horse riding accident and broke my back, and told 14 months down the line that I would never walk straight again and I would be in pain for life. Now, I'm not the kind of person to accept that. I wasn't having it. I didn't know what I was going to do, but I knew something had to change. And I could say as luck would have it, or if you believe in law of attraction, I obviously drew EFT into me. And I met a practitioner, and after about 4 or 5 hours with him, I was able to walk straight and I was pain-free. And from that, I went on to train to become a yoga teacher. So never say never is very much my motto. I've used it for many things in my life. I was able to stop wearing glasses after 30 years. So it can work on so many things. And what I have worked on is my own personal development. So when I've suffered stress or anxieties, and there have been various episodes in my life where I've needed it. So having discovered something like this, it was like, wow, I have to do it. And my background is teaching, that MA you see there, and the PG dip is all in education. So when I learn something, I just want to teach it to other people. So having gained that, then I wanted to explain a little bit about the history of EFT. It started off in America, and it was a particular doctor, Dr. Roger Callahan, who was a behavioral psychologist. That was his job. As a hobby, he did acupuncture. Now, in his mind, they were two different tracks entirely. That's work, that's hobby, and the two didn't come together. And then one particular day, I'll just stop share where I speak to you. He was working with a client, Mary, who's become very famous in our world, and she had a fear of water. Now, as a behavioral psychologist, he'd been working with her for 18 months on her fear of water and was getting nowhere, absolutely nowhere. And this particular day, and I'm sure any one of us can relate to this, even when I think about it, I go sick to my stomach. We've all had that at some point in our lives. And at that point, if you like, his acupuncture training came online, because there is a meridian that runs from the stomach to under the eye. So he just said to her, why are you feeling like that? Just tap under your eye for me. So she did. And then she went, well, that's gone. And he was like, what's gone? She said, well, I'm not frightened of water anymore. Being in California, there was a very nice swimming pool outside. So she goes charging out to the swimming pool and he thinks, oh my God, she can't swim. So he goes running after her and she goes, it's all right. I've not lost common sense. I know I can't swim, but I'm not frightened of that anymore and I'm going to learn. And he's in a state of shock. What has he just done? So he starts doing the research and he worked with acupuncturists. He was an acupuncturist himself. And he came up with a very clinical method, which is still around today, which is called thought field therapy, which I'm really glad I don't do because you get all your words mixed up. And he made it that he would do quite a clinical diagnosis and then he'd work out exactly which meridian it was and where you needed to tap. And that, as I say, still exists today. Separately to him is a guy called Gary Craig, who originally trained as an engineer at Stanford University, which he never actually practiced. And he'd got involved in the early days of something called neuro-linguistic programming, which, excuse me, some of you may have heard of, but it's very much about the programming of the brain and how we work and how we think and how we communicate with each other. And so he was interested when he found out what Dr. Roger Callahan was doing. So he went to work with him. And I think if you'd have been in that room, you'd have heard a lot of toing and froing because they would definitely come at it a different way. And Gary, like myself, and I think that's why EFT appeals to me, it's very much a doer. Let's get to this. Let's make it accessible for everybody. So he wasn't an acupuncturist, but he worked with people who were. And he wanted to know if there were points on the body where the meridians came together, and there are. And these are the points that we tap. So they come to where they come to these points, they're nearest the skin and therefore the most sensitive. But also by just tapping all of those points, somewhere along the way, we get the right meridian and we don't have to worry about it. So it's a much more accessible way of doing things. And you know, that's why I love it. So Gary developed EFT, it came to the UK, and you know, we have progressed massively and we have now a professional organisation. And you know, at the end of the slides, I'll have the contact details that you can have a look if you're interested in the science side of it, because what I must assure you of, it is very scientifically based. Then there is lots of research there. At the moment, we've been given funding by NICE, the government body, as many of you will know, who fund what's going into the NHS. We've been given money for further research. Obviously, it's got to be delayed with what's happened in the last 12 months. But, you know, that's the area we're going into. So I wanted to give you a bit of basics. So if I just share my screen again for you. Yeah, if I go into there and then scroll down. So share. Okay, you'll have to bear with me. I only learned how to do this yesterday. So the discovery statement, as Gary Craig refers to it, is that, and think about this as you read it and I say it, the cause of all negative emotions is a disruption on the body's energy system. So you are, you know, negative emotions, where do they come from? And you have this energy system, you know, and if you're trying to think, what does energy mean? If you think about, I'm always watching these house programs and people walk in and they go, oh, it's not got the feeling. That's the energy, isn't it? They're picking up on the atmosphere. And whether they're thinking, oh, this feels nice, or, oh, no, I don't like it. You've walked into a room of a group of people and some places will feel really welcoming and others will not. So that's, you know, to give you an idea of what we mean by energy, because you can't touch it, but you feel it. So the body's energy system gets disrupted in some way. Now, it can be through trauma, so that something happens to you and there's this kind of, you know, position where you feel quite tight in your body, you jump. It can be fears and phobias. I mean, I'm sure there's a lot of you today. If I just said, anybody got a fear of spiders? There's a few of you doing that. And some of you will be to the point where your feet are already off the floor the minute I've said that. So your body reacts before even your thoughts kick in. You know, I teach yoga as well, as I said, and we talk about the muscles holding your memories, because it's your muscles that react first. They do that. And if you're in a continuous state of it's not just a one-off event, but in a continuous state of a difficult situation, and your body is in regular tension. You're so unaware of it, you won't realize it, but the body's there. I see it when people come to me for yoga. I remember one chap I had who'd had a heart attack, and he'd undergone afterwards the rehab with the hospital, and he wanted more. So he'd come to my yoga class. Now, when that man walked in, he was like that. The tension in him, no wonder he'd had a heart attack. It took me 6 months, but he was down here. And that is massive. And it came through the flow, through the movement. And, for me, yoga and EFT just knit together because it's about flow. So you're carrying all this on your body. I had a lovely description given to me by one of my yoga teachers a couple of weeks ago. And the things that happen to us in life. So if I hold a glass of water, I'm holding a glass of water. If you said hold that for 10 minutes, my arm would start to ache. I would be feeling tension. It would be, they use that as a form of torture, holding weight like that. And yet we happily hold all of our past, all of our emotions, and carry them round. We literally torture ourselves. So EFT is put the water down and let go of it. So if I show you some of the ways that we go about this, there we are. So on to the next screen. Yeah. So these are the tapping points. I don't know how much of that you can read, but do just have a look at it. And you will get, you're obviously getting the recording, so you'll get these. Now, if I just work through them, they're the top of the head, side of the eye, under the nose, then the chin, then the collarbone, and then under the arm. And you'll see 2 hand positions there. So if I just show you so that you can see me doing it. There you go. So top of the head is actually slightly to the back. It's not right on top. It's just slightly to the back. And we do it with the fingers like that. So you're just getting a good grip there. And then the position, the hold we have, is the thumb across the 2 fingers and those 2 fingers there. And you tap the beginning of the eyebrow, the side, so it's the bony bit and the bony bit there, on that cheekbone bit just below the eye, that space between the nose and the lip, on the chin. Now, to do the collarbone, we make a soft fist. We're not thumping ourselves. And it's on that collarbone point. And then we take the flat of the hand and we do it under the arm. Okay. So those are the positions that we use. And those positions are used every time. That is what we call, the process. Now, that bit's easy. You will soon learn to do that. That's not really that's the positions. The skill of EFT is in the wording that we use. So when somebody comes to me, the first thing I do is listen. I want to hear how they describe their problem, their feelings. Because even if I go for that fear of spiders, you will describe it in a different way. And it will be different things about the spider that will, if I'm in a group and I ask them to tell me the reasons they're frightened of spiders, they can run up to 20 different things. So it's always honing it down to the individual, how you would describe your feelings. And I dig a bit deeper. If somebody says to me, oh, I can feel it in my stomach, I say, describe that feeling in your stomach. I had a lady the other week and she just said, it's like a tornado whizzing round inside of me. Fabulous description. That's what I pick up on. So I'm listening. And when people tell me their problems, they're going to have quite a few different feelings about the problem or the issue or the experience. So for each one of them, I ask people to give me on a scale of 1 to 10. So 0, it's not there at all. 10, it's the worst it can be. And I want to know where they are on that scale. So if I've got 4 or 5 different feelings, I ask that question for each feeling, and then I start on the one that's the highest. And if somebody, which happens occasionally, says, well, I've got 2 of them at 10, I just give it back to them and I say, and which one is the worst 10? And they tell me. And I'll have probably already guessed, because they'll do something like, oh, that one's a 10. That one's a 10. You know which one it is. So it's about the listening skills and drawing out of people. That's my, that's where the skill comes in, of actually practicing EFT. Now, when we start to, if I just go to here, right? Sorry, I'm dipping in and out, but I do like you to see me. I'm not a death by PowerPoint person, and I've just undone the share when I was trying to share. Apologies. Don't give me scores out of 10 for well, I actually, yeah, there we are. So we start off with what's called the setup statement. And the setup statement always begins with, even though. Now, I've used my spider one. I am terrified of big, fat spiders. I totally and completely love and accept myself. So even though, and I totally and completely love and accept myself, are always used, beginning and the end. In the middle is whatever the feeling is. So that person has said, I am terrified of big fat spiders. So we've been specific as to about what their problem is. Now, the reason we say that setup statement, what somebody will commonly do, if they've said they're frightened of spiders, beetles, it doesn't matter, whatever it is, or even the feeling they have, they'll quite often then say, aren't I stupid? I'm pathetic. I shouldn't feel like that. You beat yourself up for the feeling. So even though I've got this, I totally and completely love and accept myself. Positive affirmation. So whatever it is you've got, you're accepting of it and loving of yourself. Because we are really good, better than anybody else could ever be, at beating ourselves up. We do that all the time. And even if somebody hasn't said it to me, they might be thinking it. So we always set it up in that way. So that is, we craft that first. How are we going to actually tackle this? And I agree with the client to make sure that that is what they want. Then, as I've already said, we measure it, and we call these SUDs, subjective units of distress. How distressed are you? So no, as I say, it's not there at all. And then 10, it's the worst it can be. So how far up that scale are people distressed? And that's what we're looking to bring down to 0. And I always get to 0. There is one exception, and that I'm going to come to because it's really very relevant to yourselves. Okay, so if I just stop that share for a minute. Okie dokie. So the reason that I don't get to 0 on occasions is when I'm dealing with pain. Because pain is there for a reason. And that reason is to stop you moving in a way that might damage you. So your pain is there to stop you doing something that's going to make it worse. But it doesn't mean you have to have it at the height of the pain. So I would always bring pain down to about a 2. So your early warning system is there, but we're not getting rid of it, because then you wouldn't have your early warning system and then you could damage yourself. And we don't want that. So pain is the one where we say 2 will do. And then we can deal with, you've got your early warning system. You don't need to then be worried about, well, if I don't feel it, I might do something and cause damage. The other way, obviously, is dealing with the feelings. And I measure that in numerous ways. It's not just the numbers. Some people don't like to put numbers on things. So I will work with them to find a way to measure it. So I say somebody who's described their feelings, the example I've just given, it's like a tornado in my stomach. Then I will do the process of the tapping. And then I'll say, how's your stomach doing? And they'll say, oh, well, it's only a bit of a breeze now. It's not a tornado anymore. It's changed. So I'm measuring for them in whatever way they give it to me. I'm listening to their descriptions. I don't change it to suit something. So if some of you have seen EFT demonstrations on the internet, of which there are many, and you've thought, well, I'll have a go, they are very general because they can't speak to every single person that might watch a video on YouTube or something. So it works so much better, obviously, one-to-one, when we can get the exact specific words for you. Plus you're getting guided through it and not thinking you're doing it right. It's very important to allow people to express themselves in whatever way that is for them. And I'm looking, not just listening to words, I'm looking at the body. You know, if somebody is talking to me and they start getting their teeth clenched and they're doing this, and there's an awful lot of anger there that I'm watching for. And I can see the difference when we start to remove the anger, that they start to relax, that the shoulders come down, that the face softens. And equally sometimes, you know, tension because of pain or tension because of feeling the hurt. And again, I see the difference. So I'm watching everything to make sure that they notice the difference and we're aware of how their body feelings have changed. I always do an assessment at the beginning before I work with anyone, which is the Warwick and Edinburgh Mental Wellbeing Scale. And the idea of that is that it is developed by Warwick and Edinburgh universities, hence the name. And it's about 15 questions and it's positive statements. And then people let me know whether they're rarely, none of the time, rarely, some of the time, most of the time, or all the time. And I take that away from them. And then at the end of their sessions, we redo it and they can see how far they've come. Because sometimes you have been so effective that people forgot how bad they felt, which is great, which is what you want. But, you know, I've had the occasional frustration one where they go, well, I didn't really have a problem. And they've come into me absolutely raging, you know, so it's, in fact, I can probably share that with you because I've got a copy of it on my documents. So, yeah, I'll go in there and just share it with you. There it is. Give me a moment, and then I shall know what that's doing there. Come back to you, and then share. There you go. So this is the well-being scale. So as you can see, all positive statements. I've been feeling optimistic. I feel useful, relaxed, interested in other people, and so on. And then that scale. And it's just to give me an idea of where people are at. There's no right or wrong. It's just about where you're at the moment. And I then take that away and then we redo it at the end of their sessions. And, you know, what you will have seen is there's very much the movement from, say, none or rarely to some to right up here. And there's the rest of the questions. And it does vary. I once had a client, a gentleman who was in a very, very bad way with a lot of illness and negativity and so on. And when we first did this, he marked every single thing as none of the time. After I'd finished working with him, and I was working with him through social services funding, we redid the whole thing and everything had gone up to rarely. Now that may not sound a massive move, but for him it was enormous, that everything had moved. So he'd made progress mentally and emotionally. You know, for other people, it can run from, you know, from here right up to all of the time. So it does vary, but it's a really, really good measure. So if I come out of that. Normally I'd say any questions, but I can't do that. So I know you'll be putting it in and we'll do the questions afterwards. Once we've done the round of tapping, because it's not just one round and that's it, I will then say to people, right, now on that scale of 1 to 10, where are you? And they will tell me. If it hasn't moved, I need people to be honest with me and say, no, it's not any different. That just means I have to do a bit more digging, that we haven't got to the core of it. Because we're all about, you know, peeling back the layers of the onion and getting to the very core of it. Because that might not be immediately obvious, never mind to me, to the client themselves. Because sometimes things can go way back to childhood and you're kind of good at, we're very good at burying things and coping and carrying on. And you know, doing that thing again, holding the glass of water everywhere we go. So we dig till we get there. And sometimes you're working on what you think is right, and we've started to release it. And then there's that light bulb moment for them, and they go, oh, do you know what's just come into my head? That's the thing we need to be tapping on. So then I adjust it to that. When we're working with an emotion, so if it was something like, well, frightened of the spider, it's easy to use, and they're at a 10, they're really, really frightened of spiders, then the process I would use, if I just demonstrate it, we would tap the side of the hand, and the side of the hand, there are meridians that come together, and it's the flat of the fingers. And this is where we say the setup statement. So I would say, even though I'm terrified of the big fat spiders, I totally and completely love and accept myself. And we do that 3 times. Even though I am terrified of big fat spiders, I totally and completely love and accept myself. Even though I'm terrified of big fat spiders, I totally and completely love and accept myself. Then we do the round. So the fingers just say towards the back of the head. Now, we don't say the whole thing. We don't say the setup. We just say, I'm terrified of big fat spiders. 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 The soft fist on the collarbone. I'm terrified of big fat spiders. And then the flat of the hand. I'm terrified of big fat spiders. Now, the most common reaction, it's a nice big sigh. People react differently. Some people yawn. I used to work with one lady, and she was great, because the minute we started tapping, she started to yawn and she couldn't stop. She was just letting go of it. Some people giggle all the way through. Some people, I'll be honest, do cry, you know. Some people might burp. All sorts of things. Some people will go to me, oh, got me tingle, it's worked. Some people will just do nothing more than look at me and give me a little nod. So you will all find the way that works for you. Whichever it is, it's actually releasing the tension. And however you react to it, and you won't know until you've done it, but that generally is your, I find I have 2, I yawn or I do the sigh. You will see people kind of sitting more comfortably and moving the shoulders, and because again, you're releasing tension you didn't even realize was there. So I asked them then to measure on the scale of 1 to 10, and if they've given me any physical feelings with it, particularly, as I say, we're going to do a demonstration of pain. I'd want to know how the pain had changed. And then I changed my wording, because if you're at a 10 and now it's more like, say, a 7, then it would be, I'm still frightened. So we just change it, even though I'm still frightened, I totally completely love and accept myself. Do the whole thing again. Then they may have come down to a 5. So even though there's still some of this fear left, or I still feel a bit frightened, some is roundabout. When it gets to about a 3, there's a little bit. Because if I said to you at 10, there's a little bit of fear, that wouldn't be true. And if you've come down to a 3, it's not, I'm really frightened anymore, because it's come down. So the wording just reflects that until we're at 0, as I say. For emotions, we can bring them down to a 0. And that is fantastic. Because if you leave some emotion there, even if it's a 2, then the next time you're in a similar position, there's something that can spark up. And we don't want that. You know, you want to be rid of that negativity. So if you get it to 0, what I find happens, and this is from personal experience, the next time I'm in a situation, and it may be afterwards, I suddenly think, oh, at one time I'd have reacted to that, but it just didn't bother me, because I've no emotion attached to that kind of situation anymore. And it doesn't matter how long you've had something, you know, however long you've been carrying the glass of water, you will still be able to get rid of it. It's not there until, you know, I get it to 0. It's not, well, I've always had it, so I'll always have to have it. If you've got a negative emotion, we can get rid of it. And I know for some of you that might feel a bit scary, And sometimes there are things that get in the way. Some people may feel they deserve to have this problem. They deserve to have this negative emotion. Or if they're angry at somebody, they think if they're no longer angry, they're letting that person off and I should be angry at them. But anger only hurts the person feeling it, doesn't affect the other person. So there are things, people who are very heavily overweight sometimes, they use that weight as a protective barrier between them and the world. So they think if they lose, because I can work on weight problems, smoking, you name it, we get rid of it. They actually have a bit of fear that, well, if I don't want to feel the desire for food anymore and I lose the weight, where's my protective barrier? But obviously what I'm then going to work with is why they need that protective barrier. I don't leave them hanging. So we work on the reasons behind the eating. We work on the reasons why you need to pick up the cigarette. So it works in it's a lot of digging and coming down and, as I mentioned before, core issue. But I do need to know if somebody hasn't had a reaction, because then I've just got to dig that bit deeper. So I'm actually going to have some of that water now. So what I felt was the best thing was, and Victoria's been so kind to offer, is to actually let you see a demonstration. You will see, well, you won't see me because they're on my knee, but I will be taking lots of notes because I want to make sure I capture everything. And I do make many, many notes because then I want to make sure that I reflect exactly what Victoria has said to me. I'm training some people at the moment. I'm running a training course for EFT, of which we have 3 levels. And I get them practicing on each other. And you will find things like somebody saying they feel anxious. And then the person doing the EFT goes, I feel worried. And I stop them and I say, they didn't say worried, they said anxious. You use the words of the client. That's what makes the difference, not using words that you think they should be. The one I'm always challenged by is because I don't particularly like bad language, and I certainly don't use it. And if somebody wants to describe their feelings in terms of that language, then I have to use it. I can't clean it up and say, oh, well, I don't like that very much, because that's not true for them. So I just shut that bit of my brain off and say it anyway. But equally, somebody once tried with me, they were practicing on me, and I was the client, and I described my feeling, and this person tried to put 4-letter word on it. And I went, no, that's not me. That's not my description. So it's very much the words that I use as a client or you use as a client. Okay. So, Victoria, are you ready?
Yep.
Good for you. Well done. Really, really pleased you. I'm so very kind of you to volunteer because you've never met me before. And to assure everybody, I didn't take any information from Victoria before we started. I know nothing more than her name. So we're going to start there. Anything that you want to ask me, Victoria, before we start?
No, I don't think so.
Okay, that's great. So I want you, all that Nikki's already told me, if this is what you still want to work on, she said that you'd had some pain in your jaw. Is that what you want me to work on? Right. So what I want you to do for me is describe to me that pain in your jaw.
Well, it feels like someone's stamping on the joint, like where the jaw joint is. Someone's just stamping on it. And I also get pain in my neck a lot, and it kind of feels like my neck can't support the weight of my head, if that makes sense.
Yeah. If it makes sense to you, it makes sense to me. Okay. So at this present moment, so not what it normally feels like or can feel like, but right in the present moment, how that jaw, like I say, it's in the joints and it feels like somebody's stepping on it. How strong on a scale of 1 to 10 does that feel at the moment?
5 or a 6.
Okay. And have you got the pain, like you say, in your neck where you feel that you got it now? Again, on that scale of 1 to 10, how strong is it now?
About the same, probably like 5.
5, okay. What I'd also like to know, and I'm combining 2 things here, but it works. How do you feel about having that pain in your jaw?
It feels like a massive weight on my whole kind of body, because the pain in my jaw causes it to radiate everywhere, And so like in my head, in my shoulders, in my neck, and everywhere, and it feels very tense, and like I'm always kind of anticipating an attack of it, because I have had it since I was about 15, and it's just progressively got worse, and it just feels like I'm always kind of waiting for the next attack.
Yeah. Okay. And what about your neck pain?
How do I feel about it? It's also very tense. It feels like it feels like the same, like I'm kind of always waiting for it to happen, because I know that it happens kind of most days of the week, and it means I kind of have to stop what I'm doing because of the pain.
Yeah. And emotionally, how does it make you feel that you have to stop what you're doing, that it's, you know, you're waiting for it's going to happen?
Yeah, it's quite distressing, because it kind of feels like unfair that I can't do the same things as everyone else, I guess, like normal in quotes people. And because I'm a student as well, I'm a full-time uni student, it makes me feel quite useless that I can't complete my work some days because of the pain and how that affects me.
Okay. So it's unfair, and it makes you feel distressed.
Yeah.
Any other feelings in there?
Useless. You makes me feel useless.
Useless. Yeah. So useless, distressing, unfair. So on a scale of 1 to 10, how distressed does it make you feel?
About 7 or an 8.
Okay. How useless does it make you feel?
Yeah, about the same, 7 or 8.
And how unfair is it?
Probably about 9.
Okay, fantastic. So I'm going to work on your pain, and then I'm going to work on your feelings. Okay. Now, as I say, what I want you to do is have your feet, if you can, flat on the floor. The reason we don't cross anything, and it's just, if you cross things, energy gets stuck, and we're about the energy flowing. So that's why I always ask people to have the feet on the floor. Okay, my regular students, immediately I start, the feet go to the floor, but it's just to keep the energy flowing. So I want you to start tapping the side of the hand for me. That's it. That's great. Yeah, lovely. And then just repeat after me. That's all you have to do. Okay. Even though the pain in my jaw feels like someone is stamping on the joint, I totally and completely love and accept myself. Good. Even though the pain in my jaw feels like someone is stamping on the joint, I totally and completely love and accept myself. Good. Even though the pain in my jaw feels like someone is stamping on the joint, I totally and completely love and accept myself. Good. Now, fingers kind of like that, like a claw, if you like, just slightly to the back of your head. That's it, just tapping there. Beautiful. The pain in my jaw feels like someone stepping on the joint. Good. Now the two fingers, so you take your thumb across your ring finger and your little finger and towards you, and then you tap the beginning of the eyebrow. That's it. Brilliant. The pain in my jaw. Now the side of your eye, that bony bit there, okay, feels like someone stepping on the joint. All right. And then just under your eye, that cheekbone. That's it. You've got glasses under your mic, you know. Okay. The pain in my jaw And then between your nose and your lip, feels like someone is stepping on the joint.
Feels like someone is stepping on the joint.
Okay. On your chin, the pain in my jaw,
The pain in my jaw.
and then a soft fit, collarbone, just that bit there. That's it. Yeah. Feels like someone's stepping on the joint.
Feels like someone stepping on the joint.
And then the flat of your hand underneath your arm. That's it. Yeah, that's it. You've got it. The pain in my jaw.
The pain in my jaw.
Feels like someone is stepping on the joint.
Feels like someone is stepping on the joint.
Take a big breath for me. If you've got some water there, so you have some water, have a little glass of water. Now, thinking about your jaw, how does it feel now?
It definitely feels more relaxed.
Good. Can you move it any easier? Does it cause problems with movement? Are you able to?
The movement's about the same.
Okay, but it feels more relaxed.
Yeah.
Okay. So on that scale of 1 to 10 now, how bad would you say that pain is?
Probably about 4.
Okay, so it's come down from a 5, 6 to a 4. Lovely. Okay. Tapping the side of the hand again. Even though
the
pain in my jaw still feels a bit like someone's stamping on the joint. I totally and completely love and accept myself. Even though there is still some feeling in my jaw that someone is stamping on the joint. I totally and completely love and accept myself. Even though still some feeling in my jaw that someone is stamping on the joint. I totally and completely love and accept myself. It's all right, the paper slipped off. The fingers on the top of the head again. Okay. There's still some feeling in my jaw. And then the 2 fingers, okay, near the eyebrow, that someone is stepping on the joint. Side of the eye. There's still some feeling on my jaw. To the eye. As if someone is stepping on my jaw joint. Under the, it's, yeah, you know where it is. There is still some feeling in my jaw. Okay. As if someone is stepping on its joint. And the soft fist on the collarbone. There is still some feeling in my jaw. Flat of the hand. As if someone is stepping on the joint. Nice big breath and some water. So how's it feeling now?
Yeah, it's weird. It's probably about like a 2 or a 3.
Told you that weird. That's my word. Yeah, a 2. I'm tempted to leave it at a 2 for the reasons I stated earlier.
Yeah.
So we leave it at a 2. How's your neck feeling?
Yeah, better as well. Like probably 3.
3. Okay. So we'll bring that 3 down to a 2. Okay. Read my own writing would be good. Right. Yeah. Okay. So tapping the side of the hand for me. Even though there's just a bit of feeling in my neck. As if I'm carrying, how did you word it? The weight of my head.
As if the weight of my head, if I can't support the weight of my head.
I totally and completely
love
and accept myself.
Love and accept myself.
Even though
Even though
there's just a bit of feeling in my neck
there's just a bit of feeling in my neck
that it can't support the weight of my head.
that it can't support the weight of my head.
I totally and completely
I totally and completely
love and accept myself.
love and accept myself.
Even though there's just a bit of feeling in my neck
there's just a bit of feeling in my neck
that it can't support the weight of my head.
that it can't support the weight of my head.
I totally and completely love and accept myself.
Love and accept myself.
Good. Top of the head. Okay. A little bit of feeling in my neck.
A little bit of feeling in my neck.
Beginning of the eyebrow. As if it can't support the weight of my head.
As if it can't support the weight of my head.
Side of the eye. A little bit of feeling in my neck.
A little bit of feeling in my neck.
Beneath the eye. As if it can't support the weight of my head.
As if it can't support the weight of my head.
And between there. This feeling in my neck.
Feeling in my neck.
And on chin. As if it can't support the weight of my head.
As if it can't support the weight of my head.
Collarbone. This bit of feeling in my neck.
This bit of feeling in my neck.
Flat of the hand. As if it can't support the weight of my head.
As it can't support the weight of my head.
Nice big. She's giving me a big smile as well.
It's weird.
So how's it feeling now?
Yeah, probably about 2.
So it's in a good place.
Yeah.
So that is going to be a great advantage to you when you get that severe pain, that you've got something you can use to bring it down. And not having, I mean, I don't know what your treatment is, so I'm not going to assume to know, but you've got something in your hands.
Yeah.
That you don't have to. I mean, I used to, when I would say the day job before I gave everything up to do this purely, and I would work with people at work, and I used to smile to myself if I ever walked, and I worked in a very big building, any of the ladies' toilets, I think they're all in there having a tap. Just slip in and have a tap, and then because not everybody wants to do it in front of everybody else. There are ways, however. Now, what I want to come back to then is the 3 feelings that you gave me. How unfair does it feel? What number would you put on it now?
Probably about a 7 or an 8.
Okay, but let's come down because it was an 8.
Yeah.
Okay. Distressing?
Yeah, 7.
7. So that's come from 7, 8 to 7. And useless?
Probably about a 5, because if I can do this, it's at least something.
Yeah, you're not useless anymore. You've got power, haven't you? We've given you power. So even though we've not tapped on those feelings yet, we are going to tap on them, then they've already come down. So by doing the relaxing stuff, it's making the emotions relax. And of course, when we worked on your jaw, it reduced the feelings in your neck. So it always has a knock-on effect. So the one that's at the top is, it feels unfair. So talk to me a little bit about how unfair you think it is.
Well, it feels kind of like, why do I have to carry all this pain when there's people who live their lives with almost no pain every day, whereas people with like chronic pain like myself and like a lot of other people, I guess, in this group, I have chronic pain every day, and since I was quite young, and that just feels like quite unfair.
Yeah, lovely. I needed that bit more description. So tapping the side of the hand for me. Even though it does feel unfair.
It does feel unfair.
Why do I have to carry all this pain?
Why do I have to carry all this pain?
Every day.
Every day.
Which gets in the way of me doing things.
Which gets in the way of me doing things.
I totally and completely love and accept myself.
Love and accept myself.
Even though it feels really unfair.
It feels really unfair.
That I have to carry this pain.
Every day.
Every day.
Every day.
I totally and completely
I totally and completely
love and accept myself.
love and accept myself.
Even though
Even though
it feels really unfair
it feels really unfair
that every day
that every day
I have to carry this pain.
I have to carry this pain.
Why?
Why?
I totally and completely
I totally and completely
love and accept myself.
love and accept myself.
Okay, top of the head. Why do I have to carry this pain?
Why do I have to carry this pain?
And then beginning, the eyebrow. It's so unfair.
It's so unfair.
Side of that. Every day
Every day
I carry this pain.
I carry this pain.
That's so unfair.
So unfair.
It stops me doing things.
It stops me doing things.
Soft fists on your collarbone. It's just so unfair
It's just so unfair
that I have to carry this pain
that I have to carry this pain
every day.
every day.
Excuse me, I've got a throat. So thinking about unfair now, how does it feel?
A tiny bit less, maybe like one less. I can't really remember what I said.
So what do you think? What number would you put on it?
6.
6. So we've gone from 9 to 7, 8 to 6. It's coming down. Okay. So tap in for me. Even though
Still
feels unfair.
it still feels unfair.
Why do I have to carry all this pain?
Why do I have to carry all this pain
Every day.
every day?
I totally and completely
I totally and completely
love and accept myself.
love and accept myself.
Even though
it
still feels unfair.
It still feels unfair
I have to carry this pain every day.
that I have to carry this pain every day.
I totally and completely love and accept myself.
Love and accept myself.
Even though
it
still feels unfair
still feels unfair
that I have to carry this pain
that I have to carry this pain
every day.
every day.
I totally and completely love and accept myself.
love and accept myself.
Lovely. Top of the head. It still feels unfair
It still feels unfair
that I have to carry this pain
that I have to carry this pain
every day.
every day.
Gets in my way.
Gets in my way.
It still feels unfair
It still feels unfair
that I have to carry this pain
that I have to carry this pain
every day.
every day.
It's unfair.
It's unfair.
Breath. Now, what number would you put it at?
5.
5. It's coming down. We started at 9, you're down to a 5, so you're nearly halfway the difference.
Yeah.
Do it again. Even though there's still part of me that thinks it's unfair. Why me?
Why me?
Why do I have to carry this pain?
Why do I have to carry this pain
every day?
every day?
I totally and completely love and accept myself.
Love and accept myself.
Even though
part of me still
feels
that
it's unfair. That I have to carry this pain every day. I totally and completely love and accept myself. Even though part of me still thinks it's unfair. Why me? I have to carry this pain every day. I totally and completely love and accept myself. Top of the head. Why me? Yeah, the eyebrow. Part of me still feels that it's unfair. That I have to carry this pain
that I have to carry this pain
every day.
every day.
Why me?
Why me?
It gets in my way.
It gets in my way.
It's so unfair
So unfair
that I have to carry this pain every day.
that I have to carry this pain every day.
His breath. His big smile. So where are you at now?
3.
That's what my instinct told me. So I do play, I've been doing this a long time, so instinct tells me, oh, they're going to come up with such a number. So we'll do one more round and see if we can get that right down for you. So even though there's this tiny bit of feeling left,
there's this tiny bit of feeling left,
that it's unfair,
that it's unfair,
that I have to carry this pain every day,
that I have to carry this pain every day,
I totally and completely love and accept myself.
Love and accept myself.
Even though
there's
this tiny bit of me
that
thinks it's unfair,
that
feels like it's unfair, to carry this pain every day. I totally and completely love and accept myself.
Love and accept myself.
Okay, top of the head. There's a little bit of me.
There's a little bit of me.
Near the eyebrow. That feels it's unfair. Side of the eye. To have to carry this pain every day.
There's
There's a little bit of me. That feels it's unfair. To carry this pain every day. This little bit of me. That feels it's unfair. So how unfair is it?
2.
So it's come down. I won't take it any further. You can do, because it's just the unfairness. So you can do that for yourself. What I want to ask you is, how distressing does it now feel?
Like maybe 2 or 3.
And how useless do you feel?
Maybe like 1 or 2.
So a massive difference in about 20 minutes. And you can finish that off yourself and get rid of the other things. So it worked both on your pain and on your emotions.
Yeah.
So we've given you some power back. It's not the pain having power over you. You've now got power over the pain. And that's, that makes you feel good in anyway, apart from the tapping. But you've also got things you can do for yourself. So thank you very, very much for being my demonstration. You've been absolutely brilliant. So
teaching me a new coping method.
Yeah, exactly. And that's the magic of EFT, because it's in your fingers. You haven't got to go somewhere and have done something done to you. You've got it. So, that's a gift you've got for life.
Thank you.
So enjoy. Thank you very, very much. Okay. So I hope the rest of you found that useful. I'm sure some of you had a go tapping along. I hope you did, because you will benefit from me tapping. The question I sometimes get asked is, I was tapping as well, so what happens to me? I don't have Victoria's issues, but none of us have perfectly balanced energies. So I'm just balancing up my energy. So I always feel very relaxed actually at the end of a session. So you always get the benefit from it. So even if it's just a general balancing. So I saw there was questions coming in and out. So I'll go over to you, Nikki.
Hi, Janet. Thank you so much. That was really, really fascinating. And Victoria, thank you for taking part in that. And I could, just my perception of it was actually that was quite emotional for you as well, Victoria, wasn't it?
Yeah.
You had a real
the feeling into words.
Yeah, you could really see that in you. And I thought it was absolutely fascinating, just especially that you can do it with just, as you say, with the tools at hand.
Mm-hmm.
We've got a few questions that have been coming through privately or in the main chat, and I've sort of put them all in a kind of bundles, if you like,
Okay.
loads of questions. One of the main questions people are asking is, can you still use this technique if you don't feel like you can honestly say, I totally and completely love and accept myself? If you are.
Yeah, I understand that question, one that I get asked a lot. One of the things I would, if somebody says to me, oh, I'm not sure I can say that, I just say, it's all right, just say it anyway, whether you believe it or not. And in saying it, it starts to bring it up. I think I've only ever had 1 or 2 people in the last 15 years, and I've worked with hundreds and hundreds of people, who've said to me, no. So rather than forcing them to say it, I'll just say, can you say you're okay? And they can usually manage that. So I always work with people as to what their feeling is. But if we can, I'll start off just trying to get somebody to just say it anyway. And if not, well, we'll just use I'm okay. And there's something in there. So, yeah, we can always work around it. Thank
you. Sort of leading sort of slightly on from that question, in NLP and neuroplasticity plasticity terms, how does focusing on and verbally repeating the negative symptoms work?
Yeah, that again, frequently asked question. I know it seems strange. And it's for 2 reasons. One, it keeps the focus. Gary Craig, who developed it, he has a great description of, you because you never have just one feeling. There could be half a dozen in there. I mean, Victoria gave me 3. If you think of those as trees, as we'd started to bring one tree down, then it's very tempting to, that's kind of lost. Oh, so it's the other one. So we'll jump across. And he has a lovely saying of, well, they'll have you jumping around the trees like monkeys, but are you actually getting rid of the forest? No, you're not. You're just getting rid of the top. So it's to keep the focus so we get rid of the tree and its roots. But secondly, as well, when you keep repeating a word, it actually depletes in energy. I remember one particular client, and her word was vulnerable. And after we'd said it so many times, she said, what a stupid word. It no longer had the power it had. And that's, and you may have get this question. People say, do I have to say it out loud? Yes, you do. Because again, it's giving, and that's what you've just said, Victoria, giving voice to it and actually saying it out loud. The things that you're churning around inside, I'm there to listen and to take that off you a bit. But when you start to say it and you say it over and over again, it just doesn't have the power anymore. So there's 2 quite specific reasons we do that.
Yes, absolutely. And I completely agree with that. It takes the power out of that word that becomes sort of all encompassing.
Yeah.
Now, we have had a few questions about, does it matter or make a difference if you say it out loud, which you've answered. There's also been questions about, instead of saying it out loud, for instance, if you were on the train and you wanted to do it, could you write it down over and over, or does it need to be verbalized?
No, you could, if you wanted to write it down or just saying it in your head, I've done that. I've just kind of had a little tap and just said it over and over in my head, if it, like you say, if you're in the train or something.
But preferably,
saying it out loud. The other thing, there's 2 things you can do. If it's just you want to feel overall calmer, if you're just in a situation that you're feeling a bit anxious, there are 2 things you can do. One is this side of hand, and you can just rub it. So, I mean, you could do that in your lap. I'm just doing it so you can see me. And that in itself is very, very calming. The other thing you can do, there is what we call the sore spot, which is kind of about across and down. It's as soon as I touch it, you're going to go, oh, yeah, that's a bit tender. And you just gently rub it, and that will calm you down as well. So 2 spots for just general calming.
Okay.
And quite frequently when I say that, people go, oh, do you know I do that? Didn't realise I did, So,
it's quite funny, isn't it? Because lots of people have those kinds of coping
strategies.
But they're often, for instance, if I get very anxious, I can pick my thumb until it bleeds. Whereas actually, I could do something quite similar that wouldn't hurt.
Yeah.
It's finding that thing.
Yeah.
Right. So we've had a couple of sort of questions around this, which is people have been sort of joining in and they think it's actually quite helpful. Does it have to be you that taps yourself? Because for some of them with dislocations and very sore hands and that kind of thing, they may not be able to do the tapping. Can somebody tap for you?
You can. Interestingly, because it did start in America, I find a lot of our American colleagues and some of my colleagues in London will actually tap the person. We are generally don't do that, again, for different reasons. One, you've never met me before in your life and I start doing this to you. And it's very personal, it's very upfront, and that can be a bit, so that's one of the reasons. Equally, if you're doing it yourself, it gets stronger. And because you can see people starting off very kind of, and then the next thing that, so I actually see that. Obviously, I'm online now. I can't do it anyway. I can't tap somebody. But what you can do is imagine it. The brain is incredibly powerful. Just visualize yourself on doing the tapping and it will work just as well. And that works for some. I mean, when we teach yoga, we have people come to us, we've had cases where they literally can't move. And just by visualizing the movements, that you fool the brain into the thinking it's happening. The muscles actually, and eventually they can move. So it's quite okay to just imagine yourself tapping. So that's another way of doing it. Okay. So it's always a way.
Using like a pencil with a rubber on the end. I mean,
yeah,
rather than actually being the fingers.
Yes, yeah.
Perhaps you could hold, or there might be, I guess as well, it's holding arms up and that kind of thing. But that's useful to know. Thank you. Surrogate tapping. That's what I think we've just been talking about.
Yeah.
So other people tapping and where was my other one? Can this technique, and I think I know the answer to this, but can this technique be used in children with a history of complex trauma disorders with modifications? Or
yeah, you can use it with children. And one of the ways we use it with children, if you give me 2 seconds, I shall nip and get my prop for children. 2 seconds.
Thank you. While Janet's gone, I will ask a question to Victoria, because we've had a question to you, Victoria.
Oh.
Slightly off topic, but somebody would like to know where you got your gloves from, please.
They're from Chronically Colourful on Instagram. Like, she's building a website at the moment, but they're like compression gloves, but she hand dyes them, and these are custom that I got in some of my favourite colours, and I've got another pair as well. Yeah, I think they're about £20, but they're so good.
Chronically
Colourful.
Chronically Colourful.
On Instagram. Her name's Jasmine. She's absolutely lovely.
Thank you very much. Sorry, Janet, we had a little question in between.
Yeah, no, I'd noticed those, so thank you for asking. So my prop for children is the teddy bear, okay? And so that it helps them to verbalise as well, but it's how's Teddy feeling? What would Teddy like to tell us? And we actually, you can literally sew buttons on to where the tapping points are, and they can say, Teddy's feeling, and you can therefore take it a little bit away from it. We use it with adults as well. If you get people who feel they can't talk about it, well, if it was Teddy, what would Teddy be feeling? And it's just doing it in the third person. So, yeah, I mean, there are people who specialise. I don't particularly work with children. I just haven't got the experience. I work with older teenagers and above is generally mine. But people who specialise, there's people who specialise that you can use this with animals, so everybody has their area of expertise. And there is there's a few books out there. The one I can think of at the moment is The Tapping Game, which is used with children. So, and children react really well because they haven't got all those preconceptions that as adults have. I know. So actually, it's very, very effective with children. So put Ted there, that's it.
Thank you. Really quick question. How do you decide which side to tap? So right eye, left collarbone, armpit?
Doesn't matter.
I switched between both and it still worked.
Yeah. You will even see people doing this, which completely confuses me, so I don't do it. But, I'm right-handed, or if you're left-handed, you just, whichever feels most comfortable for you. But as I say, there are people who will do this kind of thing and do it all the way around, but there is no need to. Just whatever feels comfortable.
So somebody has put, which is quite interesting, I think, and might probably for a lot of people will resonate. One of the attendees was joining in with Victoria, doing the unfair, repeating the unfair. And she said that her sense of unfairness increased rather than decreased. Is this because you think she might have accepted her pain, but actually just really still feels the unfairness, and this process is bringing it out because she now feels more angry rather than less? And then the second part of that question is, with EDS, there's so many different parts of the body and history that can need helping. if you don't know where to start, how would you?
Yeah.
Sorry, 2 questions.
No, it's okay. I'll deal with that. It went up a bit. That can happen with EFT, but it goes up before it comes down, because you've got these feelings going round, but it's not often, again, that you, as we said, you give voice to them. And as it starts to come out, you're like, I mean, I've done it myself, and because I continuously tap on myself, although I've got, you think you've got rid of the big stuff, there's something can happen and you think, oh, I didn't know that was there. Hello, I'll sort you out. As somebody who's always, anger's probably been one of mine for most of my life, I can start tapping and I can feel my teeth gripping and I'm like this, and it's like, whoa, where did that come from? But then I've let it go. So it might come up at first because it's realizing you really, really feel that, and then you can get it down. So sometimes it will come up again. Sorry, I've forgotten the second part.
That's the importance of any kind of counselling or therapy, is you need to find somebody who knows what they're doing, because with all of it, it will bring emotions up before you start to deal with them. So it's important to find the right people.
Yeah. The second half of the question
was so many different parts of the body and history that need helping. How could you know where to start if you've got, it feels like every part of your body is affected?
Yeah, and I mean, I get people who come to me, obviously, and they go, I'm just, life is complicated and I feel this and I feel that, but I don't know why. So sometimes I will start on, even though I don't know why. And then that peels that layer back and it comes up. If the question is purely about the physical, just put a number of, things that are standing out. I mean, we had 2 with yourself, Victoria, your neck and your jaw. So I just took numbers for both and then tapped on the highest. We do have something called personal peace procedure, which is kind of making the list. Just go through it and do one at a time. If you're talking about the pain there.
So it's sort of like a body scan.
Yeah, and just go write
it down.
Yeah, and then just make a note of the number and start on the highest. It is actually a very logical process once you apply it, rather than, oh, what do I feel? No, hang on, just go in, like say, body scan, that's feeling this, that's feeling that, and then start on the highest. And as you saw with Victoria, it came down in the other areas because we'd worked on the one that was most dominant. So, we often talk about the table legs. If you think of the tabletop as the word, if say somebody comes to me with depression, that depression has built up and built up and built up. So what we don't do is take the top of the table off. You actually knock the legs out, because that's all small pieces that have built up those table legs. And you've got to find the one that if you pull it out, the whole thing's going to collapse. And that's what you don't have to work on, the hundreds of events that would have created that depression in the first place. It's finding the one. That's why, like you say, working with the right people, it's working with a practitioner who knows what they're doing. And because, I mean, I once had a lady ring me, it was many years ago, and she'd been playing around on the internet and she'd found EFT, and she decided to start working on her low self-esteem. Well, that's massive. And she started tapping, and of course she opened Pandora's box, that bit about it getting worse. And she at least had the sense about it to search for somebody online, and for whatever reason I came up, and she was in a total panic, and it was like 3 PM or something, and she was like, and I can't go out, and I've got to get the kids, and she was absolutely, so all I did in that instance was just to bring her down so she could go and get the kids from school, and then come back to me or somebody in your area that you can then work with on these massive issues. It is a temptation to go for the big stuff. I would please say, do not go for the big stuff, because if something goes wrong, there is nobody there to help you out of it. I mean, even when I do in-person workshops, and I say, right, work in pairs on something very simple, like, oh, I'm feeling a bit stiff sat in this chair, or I'm a bit cold, and I'll inevitably get somebody say, I just want to work on my low self-esteem. And I go, no, I said something small. Your low self-esteem is massive. So do be very, very careful with this. Don't just think, oh yeah, I can do that, because there's an awful lot of skill goes into it, and you need to be able to get yourself out of situations. So just a warning there.
Thank you. Do you keep tapping until you feel better, or is there a recommended number of rounds? I noticed with Victoria, you kind of took it down a little bit more.
I would normally have got her to 0. To be honest, I was a bit time conscious. So I thought, I'll just you were down to 2, and I know she can do that bit for herself. But yeah, I always get people to 0. There isn't a set number of rounds. You will find, again, if people go searching on the internet, some people will just carry on and go round, and then they'll go round again, and they'll go. So, you know, once you've been doing this as many years as people like me have, you do have your own way of doing it. What I'm showing and what I teach is the classic way of doing it. But, you know, I work with a woman in America, actually on a marketing course of all things, but she's an EFT practitioner. And so if we have any, what she would call a mindset issue where I can't do, now she doesn't do the side of the hand, she goes straight for the top of the head. You know, sure, I can't be bothered with that bit. So, you know, so everybody does their own thing, but that's the classic, that's the thing to stick to. But there are, theoretically, you're supposed to tap 7 times on each point. But to be honest, if you're thinking of what to say and counting at the same time, it's not going to happen. So just give it a good tap. That is what we'd always say. The 3 things, you know, we do that 3 times, but that's all.
And so give more thought to what it is you're saying and how you're saying it, rather than whether it's 6 or 7 or 8.
Yeah.
One of the questions, from what this attendee has heard about surrogate tapping, she understands it to be different than what I just said. I think that's what that is.
Yeah.
It's more, I don't know how to say this, intercessory tapping?
I'm not under that word. What I think she talked about is where you can do it for another person entirely. I would call that level 3 stuff. We have an EFT level 1, which is for personal use, family and friends. Level 2 is practitioner. Level 3 is advanced practitioner. Not until we get to advanced practitioner do we start doing surrogate tapping in that way, where you would, because it's very tempting, and this one to resist a bit, is to think, oh, and again, if we were sat in a room, there'd be a few people be saying to me, oh, my brother, sister, daughter needs you. And I'd say, start with yourself. If you think somebody else has got a problem and, you know, they need to sort out, think about yourself first. It's like saying, oh, I've got a naughty child, but is that child behaving in that way because of the interaction with you? So always, you know, I can work with people who've got naughty animals, but I start with them. Because what you don't want to be doing is standing there saying there is something wrong with you and I'm going to sort you out, because that's not what we're here for. If somebody has got pain and you want to help relieve that, I have a wonderful neighbour, and unfortunately she's just been diagnosed with terminal cancer. So we're doing a bit of work, and I obviously can't go in house or anything like that. I'm just doing it through the wall. And I'm just tapping on how she feels and just tapping away at it. But I do that with her agreement as well. So, you know, do make sure that somebody knows you're doing that. So I think that's probably where the person's coming from with the surrogate tapping.
Thank you. I mean, it's interesting, isn't it? Because when you first start thinking about tapping and EFT, and I dabbled a little, as I said to you a few years ago with some young people I was working with, you know, it sounds quite basic, but if you really get into it, obviously there's a lot more to it. And just seeing how you were working with Victoria today and kind of then modifying your words and modifying what you were doing and how you were reading her, I think that's really interesting. And we've had lots of questions around that, which is, how do we find somebody who we could work with, or how would you know? Is there a tapping website? Can they contact you?
If I just share with you, because I did put it on.
Are you happy for me to put your email address in here? People have asked.
Yeah, because I've got it on the. Where are we? Oh, share. Hang on. No, I've shared. Let me go in there. There it is. So that's my website, thepositivechangecoach.com, and my phone number, and I've got a Facebook page as well. And if you want to look at the full background, EFTinternational.org is the website for the professional association.
Lovely. Thank you.
But you see now, I mean, life has changed so much with COVID, in that I'm now totally online. So I work with people all over the world, and as well as all over the country. So I've been working with people in New Zealand, Pakistan, America, Europe. I'm on the end of a Zoom call. So
I think as wonderful as that's been for practitioners, it's also been world opening for people who want to access this kind of thing as well, especially with some of our members who may be not able to get out of the house and therefore access this kind of therapy. I think it's been really great for that. So we'll definitely be continuing in the Zoom universe for even if
it's different things as well. I mean, I've been working with a young man recently. Now he's only an hour from me, but his issue is that he still lives at home with mum and dad, and the only place he goes is his 10-minute walk to work. He won't go beyond that, so he would never have come to me. Whereas we were able to do it, he was in the comfort of his own home, and we were able to do it, and now he can travel and do everything he wanted to do. So yeah, it opens up so many different ways of doing things, and you have to be a bit flexible, because my clients in America are 5-6 hours behind me. So I've got 3 of them on training at the moment. So normally I would do that training in the morning, so I've been doing it in the afternoon. So we just alter things, but it's changed the way we train, because we used to do 2 full days. Now we do 4 half days. And I know you and I have had this discussion. If I could do a separate group for your members, so that we could do it in an hour and a half slots. So it would be 8 weeks of an hour and a half, because the level 1 is about personal use. We do say family and friends as well, but I would always caution that one, because like I was saying before, it's you're thinking they've got a problem, and you might be the problem. So
you need to work on yourself first.
It's personal use. I mean, if somebody's got a job interview and they're nervous about going, great, use it for them, but not getting into the deeper stuff. But certainly, and then if people want to go on to the level 2, that's about becoming a practitioner yourself. So at various stages.
That's great, thank you. Well, that brings us to the end of our session today. So I just wanted to finish by obviously thanking Victoria so much for being
very grateful. Thank you.
And I hope that was really useful for you. There's probably quite a few people thinking, I wish that had been me. So thank you so much for agreeing to do that, because that can be quite something,
I think you've been very brave.
I mean, I wasn't quite sure what I was agreeing to at first. I just said yes, and I was like, this actually really good.
I said, don't worry about it, Victoria.
But I think that's nice, because you were coming to it as like my clients do, without knowing anything, and therefore you were just open to it, which is fantastic. And you've now got a tool. So, and I mean, when you get the recording through, you've got the positions there for everybody that they can follow, and the website addresses and everything, and the wording.
Thank you so much, Victoria. I really appreciate that. And Janet, thank you. It's been enlightening. It's been so interesting. I've been following it with fascination and watching you work with Victoria. So thank you so much.
It's always a pleasure to spread the word.
Thank you.
Thank you so much. And to all our members, this will be obviously available through the members part of the website to log in and watch again if you wanted to follow through all that again. So thank you, everybody, and go out and enjoy this beautiful sunshine if you can in your garden this lovely weekend, and have a good weekend.